Yeah, good to see you. Okay. Let's get the usual stuff going. Awesome. Today, I was actually just thinking that I have no idea what day it is. Like, is it Thursday? Is it Friday? All the days are starting to run in together. Which is I guess it's a blessing and a curse, but definitely more of a blessing. So, yeah, it's just funny to me how that all happened. Actually, let me, green screen, move that down here. Perfect, yeah. So, blessing how that, oh shit, that's actually covering my face. So let me move that there. Awesome. Hey, yeah, so welcome. I know people are just starting to tune in here. People are just starting to migrate in. So welcome. Good to see you. Okay, excellent. All right, let's get everything ready. So we're gonna get our foil ready at least. Now you get to finally see how you make the broccoli. Nice, yeah. You are tuning in. This is the moment we've all been waiting for, yes. Now you get to finally see how you make the broccoli, yeah. It's not very spectacular. You don't want to set up like high expectations because you will be sorely disappointed. When I cook food, I don't do it for really like taste or to ever serve other people. Like I would never feed this to someone else. It's literally just for my own edification, just for my own preferences. Like that's it. That's all it's for. So hopefully, but if it's helpful to you, then that's good. I hope that it can be enjoyable process for you. So at least I let it thaw. I get these bags from Kirkland of the frozen broccoli, and so I leave them at least in the morning or overnight to thaw out somewhat. The broccoli I don't find is as crucial to thaw out, but the chicken most certainly is. Like that you have to thaw out. And okay, let's get our seasonings. Awesome. My show is on. Hey, good to see you. Oh man, I forgot to olive oil this thing. Damn. Yeah, see, nobody is perfect, and we're all learning together. Do you ever buy fresh broccoli? It just goes bad. That's the problem. I just like frozen, so in case that I go travel or something, then it's still good. That's the only. I just like it for the convenience aspect. That's all. But yeah, I bought frozen broccoli or fresh broccoli before too. I actually like broccoli a lot, as you can imagine. So I eat it raw all the time. What's for dinner? Yes, this is more the lunch/dinner. So I usually do the one meal a day. So you're about to tune in and witness all this. How can I stop gaining weight on Lexapro? It changed my life mentally. Literally just eat like this. That's how you can stop gaining weight. And you're about to see exactly how I eat. Because see, remember with Lexapro and things, it can reduce your metabolism, but you're still in control of what you eat. So you're still in control of all the food that goes in your mouth. So the cleaner you can eat, the better. So no one is able to survive on broccoli and salmon alone. I mean, it's not that I just eat broccoli and salmon. I mean, I eat a lot. Like, look how much this is. This is more than anyone can normally eat. But I just eat it all at the same time just because I enjoy that. So, yeah, broccoli, salmon, Greek yogurt, and then I have some chocolate for dessert. That's pretty much it. And nuts too. Nuts are a really good way to adjust your calories. So if you need more energy, more calories, and you can add nuts, because a handful of nuts is easily 100 and 200 calories. So I'll use a lot of that if I'm trying to prioritize gaining weight, for example. It's cashews especially. I love cashews. And cashews are so easy to gain weight on. He probably walks around in scrubs all day long. Yes. He probably sleeps in scrubs too. Okay, well, at least, okay, it looks like it thawed out decently. I find 24 hours is the sweet spot for thawing. Pistachios, yeah, but then pistachios you gotta peel apart. But I like pistachios as well too. I like almonds. I guess I just like nuts in general. Take that as you will. What would you say is a good medication to treat depression? Usually you start with SSRIs, but you can expand to many from there. SNRIs are an option. TCAs are an option, Wellbutrin. So there's different options that you can use depending on where you're treating. Why in the world do you coach nurse practitioners? Because as a psychiatrist, I've amassed a lot of expertise, and it's a shame to have it all be sitting in my head here. And because a lot of NPs come on my lives and they ask me questions, and I found out just how horrendous a lot of people's educations are, and it's not the NP's fault, it's just that the school system's taking advantage of you. And then the thirdly is that a lot of doctors will just talk shit about NPs, but I'm like, hey, I would rather be part of the solution, and because we're all going to be seeing patients together rather than be part of the problem, which is just bitching and complaining. So yeah, that is the reason. What chocolate do you eat? I like dark chocolate the most, but like my guilty pleasure, peanut M&Ms. That's my guilty pleasure, but I like dark chocolate. I went to Iceland recently and I got a bunch of dark chocolate from there. Do you get bored of training the same thing daily? How is the solution training medical students? Medical students are already getting training. The solution is you meet the needs where they're at, just like you meet the patient where they're at. So med students already have training, so they don't need any more training. They have residency and stuff that they go through. The real training which is needed is for the NP community. So I can do more good in the NP community than I can for the med student community. Like they're set, they're already taken care of. Can Vyvanse cause psychosis? Only at super high doses. Like the normal dose is not, ooh, damn, that's a lot of powder. The normal dose is not gonna cause psychosis. Okay, now let me flip this. I let it thaw. It's been about 15 hours since thawing. I think I should still do it a little bit more. Like maybe 24 hours is probably ideal. This is like the black pepper chicken. Spicy. Do you get bored eating the same thing every day? Nah, I don't. I am a creature of habit. I just like the same stuff. I haven't left my apartment in probably like 4 or 5 days. I mean, I just know I know who I am, and I know what makes me happy. Can you lose weight while on quetiapine? Yes. Tune into these luncheon lives and you'll see, you'll see what I eat, and if you eat this stuff, like that will help you lose weight more than anything else. Like this shit will literally keep you full and have you losing weight, so it's a win-win. So tell me if you're an expert at this. So I've heard that if you cover up your chicken with parchment paper, that can stop it from drying out. Is that true? Like, do you think that's something I should try? Because yeah, that's the main problem I notice, is sometimes my chicken gets a little bit dry. Can you take Wegovy with ADHD meds? Yes, you can. You can definitely take Wegovy with ADHD meds. So I cover it with aluminum, is that what you're saying? Why don't we try that? Why don't we try that today? So according to you, if I have this aluminum foil and I just put it on top, then that will prevent it from drying. Is that accurate? Right? This is aluminum foil. So, and that'll work for salmon too, right? Like if I put it on top. Let me come over and cook for you. LOL. That's the nicest thing anyone has ever said to me. Okay. I am going to trust you on this then. This is a first time for me. So we are going to do this together. Okay, so I'm going to be covering that. And then I'll cover this as well. And then put it in the oven for 20 minutes. And then, yeah, we'll go from there. Do Americans actually call it aluminum foil? Oh, cover it tighter, press it down a little. Okay. All right, fine. Like, you didn't mean just like seal it, but actually like cover, like, or you didn't mean just cover it, but actually seal it in. You can also put the salmon seed, a parchment paper, some lemon. So I do have some lemon. I don't have lemon actually, but I have lemon juice. So would I put this before or after? Like, do I put this lemon juice on before or after cooking? Wrap it, not cover it. After. Yeah, that's what I thought. I thought it'd be after. Okay, that's what I was thinking, is that you do it after. Cover tightly. All right. This is literally a team effort here, and that's what we're doing together. So let's do this. Do you prescribe quetiapine and venlafaxine? Perfect seal. Oh, perfect seal. Okay. All right, so that's seal 1, seal 2. We are literally learning all this shit together. So, okay, that's good enough. Okay, now we'll set the timer on. I wrap baking sheet first, so no aluminum food, but oh well, locks that heat in, exactly. So let me cook a meal for me, put cayenne, pepper, yeah, okay, let me set the timer. So I think 19 minutes should be good here. Do you like foil more than parchment paper? I just have more foil than parchment paper. I don't think I have any parchment paper left. So, yeah, I don't. So, we work with what we have, right? Beggars can't be choosers. How long does it take for Fexer to get effective? 4 to 6 minutes. Oh, not 4 to 6 weeks, sorry, not 4 to 6 minutes. Convection oven. I mean, I don't know. I think it's on the bake setting. What's the difference? Do you prescribe quetiapine and venlafaxine for mixed anxiety and depressive disorder? Yeah, I prescribed those before too. Venlafaxine is good for treatment resistance. Quetiapine can be good for augmentation, yeah. What's the natural option for severe anxiety? Probably L-theanine, and eating a clean diet can be helpful. And then also venlafaxine, eating a clean diet. Therapy, of course. Correcting your own negative thoughts. It's not frozen. It's fresh. It's fresh. It's not frozen. It's been thawed. It's been thawing since last night. So I think the 19 minutes should be fine. That's what I usually do. Okay, I'll keep this here. Keep that. Drowsiness in the morning from quetiapine, unable to stay awake. Yeah. Maybe the dose is too high. Sometimes that can happen if the dose of quetiapine is too high. Nice. Can you talk about neurosarcoidosis? I don't really know what that is. Have Noctur decided to unban you yet? No, I'm banned for life. I don't think they're gonna unban me. I mean, that's a subreddit that hates nurse practitioners, and I support nurse practitioners, so I don't think they are going to ban me anytime soon, unban me. Are your glasses safety glasses? No, so they're dry eye glasses, so basically I have dry eyes, and so now there's normal glasses, you don't think twice, but this helps protect my eyes from getting dry. So remember, you always want to use protection. Would you recommend taking Lexapro at night when you're first starting it? Sometimes it can make people sedated. Other times it can make people activated, so it just depends. So it depends. What dose of quetiapine is considered high? I mean, depends on what you're treating. If you're treating insomnia purely, 200 would be high. If you're treating bipolar, 600 would be high. If you're treating schizophrenia, like 1400 would be high. So yeah. Thoughts on TMA therapy? I think you mean TMS therapy. TMS, I'm going to be doing a lot of stuff on TMS actually. I just did a lecture or a live yesterday where a patient shared her experience with TMS, and then I'm going to do another one in a couple weeks where we're going to be going into the science of TMS. So it's going to be a good mix. Is it okay to take sertraline at night? Yeah, that's fine. There's no problems with that. Also, let me get my light out as well. Right, awesome. Okay, we're back. Yeah, also if you like this, definitely double tap the live. We got 168 people in here, so shit's popping right now. And yeah, if you double tap this, we can share this with more people. Let's see if we can get this to 2,500. We're already at, oh shit, we're already at 2,300. Let's see if we can get this to 3,000. We're moving. We are rocking. Oh shit, wait. The next one is right. Yeah, man, we had a good like couple days of heat, but now it's gotten cold again. So unfortunate, but you know, it is what it is. Okay, wow, we're at 3,800 likes. Let's see if we can get to 4,500. So it's about 4 p.m. Eastern Standard Time here. Yeah, let me ask you. So say 1 if you're a provider, and say 2 if you're a patient, or like just like an everyday person. I'm curious what the distribution is here. 1 if you're a provider, and just say what kind of provider you are, whether you're an NP or a PA or a psychologist or MD, etc. And then say 2 if you're a provider or a patient, or just like just an everyday person. Okay, we got ones, NPs, PMHNP, 2 going to school, 2 incoming M1, nice. Trying to get into med school, PMHNP. Hannah, good to see you from last night. 1, 2, 2, 2, 2, 1. Okay, nice. It looks like we got a good mix here. 1s, 2s. This is my 19-year-old daughter. Okay. 1, 1, 2. Nice. We have a good mix. So if you're a 1, what kind of profession are you? 2, study behavioral science, RN. I've weaned off Effexor. Yeah. Okay, nice. Congrats on the weaning. NP, nice. Okay. If you're an NP, just out of curiosity, how do you feel about your education? Because I've heard mixed things. Like I've heard people, my students tell me mixed things. So I'm curious what you think. Oh, let me put on Do Not Disturb. Naturopathic, okay. Nice, nursing student. ADHD, aggressive behavior. Yeah. Tell me, what has your education been like? Incoming medical student, okay. What's Vanderbilt? The provider of preceptors? Yeah, I think it's such BS, actually. I just had a student message me today, and she was like, hey, I'm looking for a preceptor in New Jersey. Can you help? And so I said, sure, let me reach out to my NP community. And so I reached out to them. But I was just kind of like, if you're paying for your education, why are you in charge of finding your own preceptor? Like, that's so dumb. That makes no sense. They're literally just stealing your money in that regard, especially if they're paying, if they're having you do all the work. Like, they're just providing a degree almost, but it's not really doing anything. Yeah, and then you enter a saturated market. And then once you're in the saturated market, they pretty much just pump you out. And yeah, I just think it's stupid. I think the schools are taking advantage of you. So yeah, it's a big thing. Hey, I have GAD. Hi, forensic psych. Are you Indian? Yes. Is your training program for NPs who are done with school? So it's not. No. It's if you're in NP school or you've graduated. So if you're just in nursing, I wouldn't recommend joining. It's better if you are in either a PMHNP program, like you're a student, if you're already going through your senior preceptors, or you've graduated. Victoria says, I agree, our program sets up all rotations. Precisely, yes, because I had the same, in the medical pipeline, it's very streamlined. Every time I did a rotation, I knew exactly where I was going, who I was going to be working under, how I was going to be evaluated. All of that was very, very streamlined. Yet, it's not the same when it comes to the NP education system, which is so dumb. So that's why I think they're scamming you and they're taking your money and they're not really interested in teaching you, but rather just pumping out graduates. So yeah, that's what I believe. What's your best advice for an incoming med student who is interested in psychiatry? I mean, my advice is that you just check out the field, see if it's for you. But I always say that I don't need to convince anyone to be a surgeon. The surgeons know. If I need to convince you at all to become a psychiatrist, then you don't need to. Then it's probably not for you. Simple. How was your week? It's been a good week. Yeah. Working from home, living the online life. So yeah. Let's get some clinical stuff here. I failed. Also, thank you for the likes. We're at 6,600. Let's see if we can get to 7,000. I failed all SSRIs and don't feel like Cymbalta is helping my OCD and anxiety. I've tried Anafril. Well, it depends on the dose. Sometimes people just don't go high enough. You might need to go to 150 or 200. Hi, does menopause cause anxiety? It can. Yeah, definitely. I sent you a message about your coaching. Awesome. So yeah, if that interests you, if you're an NP and you want to learn more and you want to definitely learn psychiatry, especially from a psychiatrist here, we had over 140. We're at 148 members right now who've joined in the past 3 months. So people are really joining and joining a lot. Advice for volunteering clinical hours for med school. I mean, you just do it. It's just a checkbox that you need to do. But do something that you can actually talk about and you get something out of it. How do I taper off 10 milligrams? 10 milligrams of what exactly? I'm a psychotherapist. Nice. Can someone with bipolar disorder become a psychiatrist? Yeah. I mean, I remember when I did my psych rotation, we had this doctor. He was a pulmonologist, and he had bipolar, and he was he was getting hospitalized because he had some problems with complication. But, he was a doctor, he was practicing. So, yeah, vortioxetine, Trintellix, right? Are you trying to taper off of it? Seroquel causing weight gain, very, very common. Do you do coaching for psych PAs as well? Yeah, so we actually have a couple PAs in the program. And in fact, it was actually, one of the reasons I actually got started with the NP coaching program was a PA friend that I have, and she gave me the idea. Because she said that a lot of APPs, they sometimes they don't feel like their education is really that good, and so she encouraged me to start that. She said hey, for example, in her job, she has some cases that she would love to staff with a psychiatrist, but she's not able to because they just pretty much just have her cranking out patients, and the psychs who work there are way too busy. So that's how I got the idea. That's one of the ways I got the idea. And yeah, so that's something we do in our coaching program as well. Is every week we have case reviews where we go through different cases together, and that makes a huge difference, I think, because then you're not just guessing about the case, but you get to have other people's opinions as well. Is it worth for a psych NP or to go for PMHNP and get a PMHNP certificate? I'm not really sure. Wait. Is it worth it to be a psych NP or go for FNP and get a PMHNP certificate? I'm not sure. I mean, it just depends on how you want to practice. Think about how you want to practice, and then you go from there. That's the most important thing. Marizal said, yes, I want off. How do I taper from 10 milligrams of vortioxetine? I mean, you just come off very slowly. That's the thing. You don't want to just be doing it too quick. When you're trying to come off psych meds, and then sometimes you just have to tolerate a little bit of the withdrawal too. If it's really hard, then you can add on Prozac, and then fluoxetine can help make it easier to taper off because that's the easiest SSRI to taper off. Do psychiatrists only prescribe or they do psychotherapy too? Usually it depends. Like I do both, so I see most of my patients on Wednesdays. So, but I usually see clients for more like detailed level of work, and so I do both therapy and coaching. Guanfacine for ADHD in adults, what do you think about it? Probably not as effective as for kids, but if you have super hyperactiveness, then it can be effective. It's just that kids are way more hyperactive, so that's why the ADHD treatment's more effective for them. Thoughts on ashwagandha? Yeah, and L-theanine. Yeah, I prescribe both of them to my patients, and so that's actually I actually teach a lot of integrative psych in our NP coaching program as well. But ashwagandha is good for long-term anxiety treatment. It's kind of like more like an SSRI. It takes a while to build up, whereas L-theanine is more immediate. So L-theanine, you notice the benefit when you take it, and then when you're done, you're done. So yeah, I would recommend you can do both for it. Awesome. Yeah, we got 173 people in here. So if this has been helpful, definitely double tap the live. Let's see if we can get to 9,000 likes. Have you ever discharged a patient? Yes, I have. I literally discharged a patient yesterday. There's some stimulant-seeking behavior and just disrespect to me as well too. Basically, I got a message saying that I need to do my effing job because the patient was having issues with stimulant filling, and so I said, okay, like this is inappropriate, and like you can't tolerate that kind of behavior. So this is really important. If you're a provider listening to this, listen up. So if patients are misbehaving with you, then you should not be tolerating that, because every instance of you tolerating it lets the patient know that it's okay to do that. And I tend to be more lenient than most. Like the patient had already missed 2 or 3 appointments, and I was very lenient with her. I was like, no, she needs help. But then after that, when she talked back to me like that, I was like, okay, no, that's too much. It's too much. So, you definitely need to make sure that you don't get disrespected, because the system will take advantage of you. Like the ER will take advantage of you, right? Like I've had so many nurses I've worked with when I did ER work saying that like the patients were talking shit, they were arguing, they were physically threatening, and the nurses were just told to take it because you're supposed to do that as a healthcare provider. And then especially in the outpatient setting too, if you have patients who don't respect your time, they don't respect your training, they don't respect your autonomy, they don't respect your clinical judgment, and they treat you that way, then you don't want to keep them off. Like you don't want to keep them like that. It's absolutely unacceptable. I mean, yes, if they're sick and manic, of course that's different, but you can tell if the patient's in the right head state or not. So you absolutely need to understand that as a provider. So awesome. I'm glad that this has been helpful. We have 200,000. We have 200 people in here. We're at 97 likes. Let's see if we can get to 11,000. Let's see if we can get to 11,000 likes. And we got 200 people here, so we are cooking. And our food's about to be ready as well, too. Let me get the light going a little bit more. Do you do peer reviews? I'm not sure what that is. I don't know what a peer review is. Can you explain? Oh, Rip. I'm just waiting for that broccoli. Yeah. So I'll show you what I do with. Oh wow, the question just rolling in. So if you want me to really prioritize your question, then the best way to do that is by subscribing, because if you sub, then your questions will stand out above everyone else's. So definitely look at subbing if you want your questions to stand out, because like you can see, we have over 200 people in here, so we are cooking. Like we are really working here. Are you serious? I'm always serious, except when I'm not. I want to come off olanzapine, want to try a different drug. How do I cope with hearing voices? I want to come off olanzapine, then you just switch around. Like you just switch to your medication. Like you work with your doctor to switch. Is 600 milligrams for quetiapine, social anxiety disorder, too high? It's higher than I've normally seen. That's when I start to enter psychosis territory. But, everyone's different. So there might be some mood lability that's being treated there too. Not just anxiety. You do telemed? Yeah, I do all telemed as well. So Cassie, thank you for the sub, Cassie. So remember that, so if you want to work with me, like for example, if you want to book a appointment, best way to do that is through just send me a message and you can book a consult, and we're seeing if we're a good fit. Just picked up Latuda from pharmacy. Yeah, it can be somewhat sedating, so usually I recommend people to take it with dinner. Serious question, would you as a psychiatrist take psych meds? Yeah, sure. Of course. Like if I needed them, I would. And plenty of psychiatrists take psych meds. Like plenty of them do that. Like I have a patient who's a psych PA and she's on sertraline. So, yeah. Oh, that's the timer. Lexapro give me night sweats. Yeah, Lexapro can do that. Usually it's the SNRIs that do that more, but Lexapro can do it too. Okay, so at least our food is ready. So I'll cancel that. Where are my mitts here? All right, and now we're gonna be testing out the wrapped the wrapped food. Let's see how it comes out. I do think this is gonna come out well. I have faith. I have faith. It looks very juicy, as you are about to witness here. So what I typically like to do is I get at my stuff one at a time, so that way it all stays warm, rather than getting it all out later, or rather than getting it all out now. But let me season the broccoli a little bit more. So at least what I like to do with the broccoli is I cook it somewhat first, and then I will season it a little bit more, and then just let the broccoli chill in the oven for a little bit longer. So that way it cooks a little more further. That's what I like to do at least. Again, I'm no chef. I just want it to taste like decently good as I enjoy it, as the nutrients go in my body. Like that's it. That's my goal. But okay, we got and then I'll leave 2 other pieces of chicken in there as well too. Thank you. I will look into it. Awesome, nice, clean kitchen. Yeah, we try to keep things clean here. Okay, we'll season lemon pepper. Put some lemon juice on it. You have to put it back and grill it without. Why do I have to put it back and grill it for another 5 minutes without the aluminum? Why? I feel like it came out okay. Oh, that's what you mean by peer review, like an insurance kind of review. No, I don't do those. Because I think those, like, the whole incentive is to not get coverage for them. I just live the social media life. That's what I do. Yep, grill for another 5. Oh, okay. Well, at least the other stuff, the other one I'll take off, and I'll let. We'll do a taste test. So that one I'll let cook for another 5. This one I won't. Also, what's the rationale for doing it for another 5? Well, it's definitely more juicy for sure. I do agree with that, but I also find that the flavor doesn't really get deeper. So I wonder how I would solve that. Like, would you just have to marinate it for longer? Would that be the way to have it go deeper? Because then I'm just like overcompensating by putting in more seasonings. again, I'm not a chef, I'm not an expert. Like for me, it's all about just maintaining functionality. Like that's literally the only thing I care about, just making it functional. But yeah. Okay, now let's move this over to where we need to. And then we're gonna get our thing here. Use a fork and poke holes when seasoning before cooking. Helps a lot. But what if it's frozen and I can't really poke holes in it? That's what I'm wondering. Yeah, I think that's the problem I have. I can't really poke holes in it if it's frozen. Actually, maybe let's try this view. Yeah, I think this view's good. Okay. Perfect. But I feel like that's a little too close. So I'm gonna back it up a bit. Basically, we'll figure out the best angle. Rip. Do you add lemon and garlic? Defrost prior. So I defrosted it prior, and I did add garlic to it, but I didn't add any like lemon. I have some lemon juice. Should I add that before or after? That's what she said. Defrosted a day before. Yeah, so I defrosted a day before. Yeah, I defrosted it last night. I'm just wondering what I should add. So I just do now salt, pepper, garlic. Where's the broccoli? It's coming. The broccoli's cooking. I like to get on. Ooh, the salmon definitely is way more juicy when you wrap it with the aluminum foil. That's a good hack. Thank you for that. And then next time I'll try unwrapping it for 5 minutes after too. Looks yummy, yes. Yeah, it came out well. See, every day we go live, we get better and better. Any good book for someone starting over at 60? I don't know. But I mean, I read mostly business books or fitness books. Are you a PsycNP? I'm not, but I train or I teach PsycNPs. I have a coaching program where I teach PsycNPs psychiatry. Are you in Canada or US? Maybe chat, you can tell us where I am. Let's see who knows. Chicken needs more flavor. Yeah, how do I, you have to tell me, how do I add more flavor to it? Like, okay, so let's figure this out. So if my dilemma, basically I defrost chicken the night before, and now like the day of, what do I do to add more flavor? Use masala. Yeah, so what, no ranch, no, I don't like ranch, I don't like dressing. Like just seasonings. What do I do to add more flavor to it? Do I just need to season it more? Do I need to let it soak in more? Do I need to let it cook more? Marinate overnight. But what if it's frozen? Lemon pepper. I like lemon pepper salmon more. I don't like lemon pepper chicken as much. Unfreeze day before. Yeah, I defrosted it last night. So good. No, I'm trying to do minimal work. Minimal work. Like, I'm not a cooking mama by any means. Why did you use psychiatry over psychology? Because I wanted to go into medicine. Like, I like the biological side of stuff. You can slice it in half and season it more. But I can't slice it in half the day before because it's frozen. So I have to slice it in half the day of then. But then it's still kind of frozen. Cut in thin strips. Do you recommend NP or DNP? Ooh, smoked paprika. Okay, I'll add that. It depends. Like if you want to practice more admin stuff, or if you want to do more clinical. Ooh, I think the salmon. It's like, I can see why you say you should grill it more. It seems like a little pink. Like it's not like super pink, but it seems a little pink. Well, do you like spicy? A little bit, not too much. Do you know anything about CFs? I don't know what CFs are. What do you think after 25 years an antidepressant would not work? You mean 25 years of still being on it? Dill goes well with salmon. Interesting. I like lemon a lot. Like lemon and salmon go well, really well. Do you cook the food at work? This is my work. May I ask you about how to deal with the young teenager's depression? Yeah, I mean like medications, therapy, a lot of it's pretty normal for them to experience that too, so I think that's part of it. Helping them find hobbies that they're really into. So being supportive, understanding they're most emotional. Yeah, so are you cooking it there or working it up? Yeah, so I cook at home. I do 2 exams at the hospital. I came back positive. For what, COVID? Our broccoli needs to come out now. Yeah, I'll come out and I'll go back and get it. But I don't mind if it chars out a little bit, because usually I'll just try to eat and then let it come out. Make a salsa for the chicken. It's too much work. I just want to put a bunch of seasonings on it. So maybe what I need to do is just let it defrost for longer. So instead of like 15 hours, maybe I'll do 24 hours. Okay, I'm gonna get some more broccoli. Because now what we're gonna do is we're gonna get our broccoli. We're gonna get our the other piece of chicken, so we'll try that. And then we'll also get our 24-hour to defrost chicken, yeah. And then we'll also get our broccoli, yeah. Every time I see you live, you're eating. Yeah, maybe because every time we go live, I am eating. See? And this way, you know that I'm not just BSing you, because a lot of people will tell you, oh yeah, eat healthy, but then they'll actually just eat crap, and like they might have a bite and then they'll throw it out. Like you see it, you see this in IRL. This actually enters my stomach. Okay, so there's one thing. So you know there's no BSing here. And then here's some of the broccoli as well, okay? Again, I don't know the proper way to do things. Like, I'm no chef. I'm just a regular, everyday bro. Don't you broil? No, I don't boil it. Okay, so let's actually test this chicken now that we've let it cook for a while. Actually, I might put the salmon back in there too. Just let it heat up for a bit. Basically, now it's just heating in the oven. I've turned it off, so it's just using its natural heat. If I'm an antipsychotic on bipolar 2, interesting. So if I let it dry, if I let it grill for a little bit more, it does get a little bit more chewy. Now what if I put in some lemon? Will I be fine after taking 600 milligrams of Latuda? I think you mean 60. 600 is more like Seroquel doses. Also, we got 216 people here, so definitely tap the tap to see if you're liking this. If you're liking this like cooking show. Nah, 600, that's impossible. A friend is having a terrible time getting off Effexor. Yeah, Effexor is hard to get off. It's not the easiest. If I'm on an antipsychotic for bipolar 2, what can help with reduced libido? Wellbutrin can help. Checking your testosterone. Ashwagandha. Zinc. Zinc is commonly used in testosterone supplements. Stuff to increase blood flow as well. Exercising. Wait. That was a piece I wasn't supposed to eat. What are those glasses for? They're for dry eyes. Also, yeah, so now the crowd has shifted a bit. So who here is say 1 if you're a provider, like an NP, psychologist, PA, MD, etc. And then say 2 if you're an everyday person or a patient, just out of curiosity. If you're 1, say what kind of provider you are. 1. 2, 1. Psych intern 2. Okay, looks like we got a good mix here. Triple board certified NP with PMHNP. Nice. Okay. Looks like we have a good reviewer. We got a good mix here. Both NPs and then also with patients as well too. Nice. We got a good mix. So yeah, hopefully if you're a provider, you're off work and we're not watching during the lunch breaks. You know, it's a Friday. We should be out. FNP. Hey, Christoph, seeing you. Yeah, good to see you. Good to see you. Yeah, we got over 220 people here, so we are definitely cooking. What do you think of L-theanine? L-theanine is a great supplement for anxiety in the moment, like to calm down immediately within 30 minutes. So I actually teach it a lot to my. So I have an nurse practitioner coaching program specifically for psych NPs, and so something that I teach is like the dual protocol of ashwagandha and L-theanine. So ashwagandha can help a lot with extended anxiety, like long term, and then L-theanine can help with immediate anxiety, just like an SSRI and a benzo, except it's not as strong, of course, but it can be helpful for a lot of those mild cases. And you can also add in magnesium too. That can be your trifecta. Intuitive. Yeah, Intuitive we use a lot for ADHD. Intuitive is aka guanfacine, and we use it for ADHD a lot. For hyperactive ADHD. And for impulsivity or mild aggression. So for example, one of our students, she brought up a case of this gentleman who has autism, and he has a lot of aggression. And so for that case, they'd already tried guanfacine and clonidine, but that wasn't strong enough. So in that case, we had to use antipsychotics like risperidone because the aggression was too severe. And that's what I found that happens with some patients who have autism who was more severe. Like we're not able to control the aggression alone. But if it's more mild, then you can actually manage the aggression through guanfacine and clonfacine. Strattera is used for It's an SNRI. It's used for ADHD, non-stimulant. Is guanfacine also for blood pressure? Yeah, it originally was a blood pressure med, but they made it into, or they found it was helpful for ADHD. Guanfacine dosing generally goes from 1 milligram to 7 milligrams, give or take. What do you think about Fanapt? I haven't found any good uses for it. Basically, the problem with it is that it has to be dosed twice a day. And yes, I think its weight gain is a little bit less, and it's got less akathisia. At least that's what the sales reps say. But the twice a day dosing, and I can't dose it up, and I have to follow a specific titration protocol to increase it. And you have to be a little bit slow with it because it can cause orthostatic hypotension. So you have to prescribe it very weird. You have to do like 1 milligram twice a day, then 2 milligrams, then 4 milligrams. So it's a lot harder. Yeah, if Adderall instant release is causing anxiety, sometimes switching to the immediate extended release can help because it's more of a gradual change rather than an immediate change. The broccoli looks delicious. Thank you. Can 5-HTP and theanine be taken together? It can. I don't think 5-HTP is that useful though, because it doesn't really get absorbed in the blood-brain barrier that well. So I think it's more like a marketing thing rather than anything. But that is my opinion, at least. You know, and you have to remember that supplements are a huge profit margin for the supplement companies. So they really try to maximize or overstate the benefits of supplements. So any company that's selling you a supplement, always remember that. They'll always try to maximize and overstate the benefits. Quite frankly, like there's only a couple supplements that I really think are that useful. Omega-3s, magnesium, L-theanine's really good, ashwagandha, zinc, vitamin D. Those are I'd say some of the iron, of course. Those are some of the higher yield ones, in my opinion. Okay, let me move this over. Lion's mane. Yeah, lion's mane can be good for cognitive enhancement and memory. Like, think of it like a natural cognitive enhancer. That's the way I would think of lion's mane. See, what I find I have to end up doing is that I have to constantly like re-season the food to make it good. So I wonder if I have the ways to change that. But I'm no expert. What do you normally eat every day? Tune in every day, and you will see the normal eatings of every day. And actually, yeah, Melissa Jill says, do you ever treat chronic pain with Lyrica as a psychiatrist? Yeah, I do. So usually I'll start with Cymbalta, duloxetine first, and then if that doesn't work, then switch over to gabapentin or Lyrica. And then I like it for patients who also have anxiety comorbid with it too. I prefer gabapentin, but they both work. They both work. I just find gabapentin's a little bit cheaper and better. People can stock it a little easier in the availabilities. Do you treat chronic migraines? I'm not a headache expert, but sometimes I've used amitriptyline, a TCA, to treat chronic headaches. Oh, and you can also use TCAs to treat. You can also use TCAs to treat chronic pain too. Marinating the night before would help. Yeah, the problem is I have frozen tenderloins, and so marinating the night before wouldn't really work with them. Does gabapentin cause memory loss? Sometimes people experience memory loss, but I've seen it more at the beginning. I don't know if it's been studied so long term to know that, but it's not as known for causing memory loss. Something like Benadryl though is. Which TCA is your go-to for that? It depends on what I'm treating comorbid. So if there's insomnia, headache I'm treating comorbid, then I would use amitriptyline. If there's if I just want the cleanest TCA and I can track levels with it, I would use nortriptyline. If I want OCD treatment, I would use clomipramine. Those are the three that I go for. Amitriptyline, nortriptyline, and clomipramine. And doxepin for sleep. Also, definitely double tap this if you're finding this helpful. Double tap like, let's see if we can get to 16K likes. We're already at 1,400, so we're cooking it. Thanks. I usually have to marinate it immediately after buying it, then I freeze it. Yeah, I just don't like cooking. That's all. That's the problem. You're always on live, OMG. Yeah, I want to become the #1 psychiatrist on TikTok, especially TikTok Live. So that's my goal. Like, I don't see anyone else really doing this, and so I'm just like, why can't I do it? So yeah. Lexapro or Zoloft in first line, MDD or GAD. They're both pretty similar. Like, there's not much difference between them. I think Zoloft has a little bit more side effects. It's a little bit worse tolerated, but anecdotally, it's a little bit better for anxiety. I enjoy lives. Appreciate that. Yeah, we got 247 people here, so we're definitely cooking. Why? And we're at 16K likes. Nice. Let's see if we can get to 18,000. Let's see if we can get to 18,000 here. What do you think about taking meds long term? I think if you have to do it, you have to do it. Meds are always risks and benefits. So if the benefits outweigh the risks, then you do it. Because some people, like, they have debilitating OCD or anxiety and they just need it to function, or ADHD. And if you need it to function, it's better to be on meds long term rather than trying to function and failing and like losing your job or getting worse with your kids or not being able too anxious to do life stuff.